The vagus nerve is gigantic. It has innervations that thrust its way into the face, neck, and head, throughout the lungs, the heart, and of course the organs. In this video, I'm going to share with you how you can stimulate some of those vagus innervation centers in the lungs, diaphragm, and the heart. So you'll place the Coregeous Ball directly underneath your ribs, and that really is from armpit to the floaters, but see if you can stick within the higher realm of your rib cage for now. And then take your other hand and you'll place it on top of the rib cage. So this does require that you have some amount of internal rotation in that shoulder. So if you can't actually touch your own rib cage, what you can do is you can actually put a pillow here and just let your top arm rest, because you just want to have a little extra pressure in the top ribs. Now the breathing practice is very simple. You'll take a breath in and feel your breath expand into the Coregeous Ball and into your hand. Hold your breath and then contract the muscles within your rib cage. It's almost as if you were going to try to cough, but you can't. And then exhale and let your breath exit out your body. After you exhale, rest until you need to breathe in again. So we're going to make this into a little bit of a pranayama strategy, a breath strategy. Then when you need to breathe in again, you breathe in, expand your ribs, hold your breath, act as though you're going to cough. So there's like a little mini valsalva in here, and the valsalva stimulates the baroreceptors in your aortic arch. That is, we have a pressure sensor that as the blood comes out of our heart, and this is another way of stimulating our vagus response. And then you exhale, and then after you exhale, you rest until you need to breathe in again. And then let's go ahead and switch sides. So as you breathe in, you want to feel that you're expanding the perimeter of the ribs. Go ahead and stack your hand there. Breathe in, hold your breath, and within that held breath, it's not just about contracting and bearing down, but act as though you would cough without coughing. And that triggers a little bit of a relaxation response for the diaphragm muscle in and of itself as well. And then go ahead and exhale. And as you exhale, you can use your hand to coax the outflow of air. And then at the end of exhale, wait until you need to breathe in again. So we're also trying to get a sense that we're listening to our breath rhythm and to our breath needs. And just that amount of attention in and of itself is also extremely focusing and relaxing for the nervous system. Lastly, go ahead and roll face down so that the Coregeous Ball rests directly on your sternum. And so here we're actually going right after our heart. So the vagus nerve innervates the sinoatrial node. It's the heart's pacemaker. The vagus nerve is also peppering throughout the lung tissue in and of itself, as well as dropping into fascial tissues in the central tendon of the diaphragm, especially right around where the esophagus plunges through the diaphragm into your stomach. But here we're putting the pressure on the sternum. Once you're full of air, hold your breath. Again, attempt to cough without coughing, and then exhale. And so the placement of the ball right now, being at this heart region, is directly attempting to stimulate this baroreceptor region at the top of the heart. If you did the video neck anew, you were able to stimulate the baroreceptor region on the side of the neck. Here we're doing that same mechanical pressure into the top of the heart, or we're indicating pressures in that direction. Obviously, your rib cage was designed to protect your heart and your lungs from being touched directly, so we have this indirect pressure from the Coregeous Ball that will indeed induce that relaxation response. So you can do this for up to 10 minutes, 20 minutes, especially if you're prone to anxiety or panic. This is a great way to flip your stress response and settle down so that you feel a little bit more calm, collected, and at peace.